Hello, this is Abhisek. I am a new graduate nurse in this ward. I am doing this presentation focusing on one of the major problems in our health sector, which is excessive workload for nurses due to understaffing. The main objectives of today's presentation are these on the screen. Let's have a glance at the background of understaffing at nursing and overload created. Understaffing is created because of economic aspect of health industry. It is a misplaced strategy by health facilities to reduce costing and have financial savings. However, it is adversely affecting on making the workforce more vulnerable and compromising patient safety. It has increased the length of hospital stay for patient, increased morbidity and mortality, and occurrence of adverse events. On the other hand, nurses have stress in jobs and elongated hours due to which they are deprived of quality of care. So let's look at what the problem is. Nurses have excessive workloads in healthcare facilities because of the nurses to patient ratio. This not only makes nurses physically and emotionally exhausting but also restricts them from providing optimum nursing interventions, which imposes risk for patient safety. So let's talk about consequences of work overload on nurses and its significance. Nurses have overwhelming workloads which results in quality of care and safety of patient being compromised because they are looking after many ill patients at once. Nurses are forced to do longer shifts with less number of colleagues, due to which they become fatigued mentally and physically very easily. Each new patient allocated to nursing workload increases the likelihood of mortality of patient. Increased overtime is directly associated with UTIs, ulcers, falls, respiratory infections, and patient complaints. Patient safety is only achieved when Patient safety is only achieved when nurses can focus on the individuals at high risks, do the checks, follow the guidelines for infection control, do regular sighting of the patients if necessary, and other safety necessities. However, with such a load of patients, the nurses have less time for each priority or strategies they have planned for the shift. Even after using a shift planner, it might be difficult for nurses to implement them due to the load they would have in the shift. Nurses are forced to leave work undone due to lack of time. This is not a healthy practice and could lead to patients not getting recovered in time and elongating the length of hospital stay. As per Twig Gelder and Mayer's 2015, the amount of concentration they need to put for each patient is diminished, because of which necessary cares like hygiene, falls prevention, infection control could be compromised due to the significance of time. So let's look at what is being done about the problem. Not many steps have been taken to resolve this problem. There have been many campaigns by unions to improve the ratio in aged care in hospitals. On the other hand, nurses are given education on how to deal on busy ward through time management strategies. The hospitals have some contemporary and on-call staffs to fill in if the ward is expected to get busy. Time to time inspections from higher level officials, norms, our managers are done to ensure what is running smoothly and is ready in emergency situations. There has been continuous efforts to improve skill mix and advancement in technology in healthcare facilities. However, these elements are not working so proper leadership is required throughout the sector. So, how can effective leadership resolve or mitigate this problem? Effective leadership in nursing helps in creating a reliable vision and helping colleagues to achieve goals and bring the change. This issue might be resolved in different levels of nursing, which I have discussed here. At regulatory and executive health system level, nurses are not only involved in wards but also in departments, agencies, and regulatory bodies who advocate and shape the policies and guidelines for nursing. These leaders have the potential to eradicate the problem of understaffing as a whole. Is the nature of their job. They have broader knowledge in different aspects of nursing and identifying issues in the system. They also have access to people or body that can enable change for the sake of healthcare system. An effective leadership by nurses in that level can bring into account the number of researches done along the system, change policies in accordance to need of the nurses under under understaffed circumstances throughout the system contribute to national debates on how nurses struggle by overwhelming number of patients they are allocated to each shift. The nurses with clinical backgrounds such as director of nursing have deep knowledge about how understaffing has affected nurses in ward level. They can advocate and interact to bring reform in policies and regulations which could contribute to economic, political, and societal incentives which could aid in resolving this problem. At ward level, effective leadership in ward is key to resolving this problem. A leader in ward could be anyone. This could be new graduate nurses, senior nurses, or team leaders. Ways of how leadership in nurses can help other colleagues in stress due to understaffing. Nurses, along with TL, should have strong communication among each other. An effective leader would communicate effectively and offer help for colleagues. A leader should always understand how other colleagues are struggling and should be able to initiate strategies in response to the leader. Should always be concerned about how these issues might make the workforce more vulnerable and patient safety could be compromised. Ways of how leadership can help in skill mix and allocation problem due to understaffing. Senior nurses could take complex cases so that there is a work balance between junior and senior nurses, but should be aware not to put pressure against them because that would not help to maintain a healthy workplace. Senior nurses should be concerned about their own level of stress as well as how junior nurses are doing in the ward. They could frequently offer help. Help might not only be physical but also emotional encouragement and knowledge sharing. I'll explain what my and other nurses' responsibilities are as a new graduate nurse in relation to the concept and skill. As new graduate nurse is equally responsible in maintaining this concept that healthy workplace and patient safety should be maintained at any cost despite the fact that the nurse have excessive workload because of understaffing. New graduate nurses should follow these steps. Number one is following policies and guidelines themselves regardless what is being followed wrongly in the ward. New graduate nurses are no different than any other nurse in the ward. They can have consequences same as a senior nurse. However, as a new graduate nurse, one should be careful on how they learn to perform tasks in a ward. There could be a nurse who is practicing wrong technique due to overload of tasks or any other reasons. But new graduate nurse should always follow the legal nursing practices. It comes under the standards of practice to avoid any nursing practice that may cause harm to the patients. Number two, seeking help when necessary and not putting patient at risk. New graduate nurses are expected to look after patient on their own. However, they can always ask for help and clear their doubt whenever necessary. It is their responsibility to be accountable for whatever happens to patient. New graduate nurses should not learn to leave tasks undone because of time rush or because they do not know. They should always show their communication skills and teamwork skills by asking more help. According to the standards, new graduate nurses should be able to maintain capability for practice and provide safe, appropriate, and responsive quality nursing care. They also have the responsibility to show respect and kindness to patients. They should not rush any procedures or preserve the dignity of the patient. Number three, only adopting healthy practice and not acquiring bad working culture. New graduate nurses should not come under any pressure of senior nurses to perform wrong nursing practice. However, new graduate nurses also have ethical duty of not to confront the nurses for their wrong practice. They should ask or suggest the nurse about the concerns. They should keep in mind that ward is a professional area where they should respect each other, so actions should be taken professionally rather than in a confrontational way. According to NMBA, it is duty of a new grad to maintain professional relationships with their colleagues. The final one is encouraging nurses to change their practice if it's wrong and not backing up just because you are a new graduate. If a new graduate nurse come across any situation where senior nurses who are not following procedures as they should and are risking patient safety, they should have conversation with the nurse to not follow such measures and escalate if necessary. According to the SCSQHC 2017, one has responsibility to report any incidences that caused or might cause risk to nurses or patients so that such practice is eradicated to keep the workplace safe. I will demonstrate an example of how new graduate nurse can show their skills. In a ward with shortage of staff, another nurse is rushing through her tasks. If I was a new graduate nurse and see her going to an infectious room without PPE, I would approach her and talk with her about consequences of not putting the PPE. The nurse might have known that but forgot it in that case. So at the time, I would reassure and offer help if she needs so. However, if the nurse starts to do the same, I would not argue with her but escalate the scenario. For this, I should have a good knowledge about policies of the hospital, how to maintain professionalism, and how to promote healthy workplace and safety whenever we are facing shortage of staffs. These are my references.